So rotator cuff surgery is fairly straightforward. The goal is to take your rotator cuff tendon, pull it back out to its normal position, and then secure it in place. And that can be done arthroscopically, or it can actually be done in an open manner. There's a few subtle differences between the two. I think arthroscopic surgery is easier if you were trained that way, to stick a camera into the shoulder, visualize the tendon, and then use other instrumentations and other hardware to repair the tendon back to place. An open procedure is making an incision and actually looking at the tendon. I think arthroscopic surgery gives you the advantage of seeing more in a small space than, say, an open procedure, because the shoulder joint is, it can be difficult to visualize. You're having to, in an open procedure, go through muscles and look down into a deep space, find the tendon that's torn and pull it out. Whereas arthroscopic, you're using a small camera to go through the muscle, and you'll be able to see much more of the anatomy. The general process, whether it's open or arthroscopic, like I said earlier, is to just grab that tendon and pull it out to the top of your arm bone and attach it there. We often use suture anchors, which are basically screws with strings. You'll put a screw into the bone, take the string attached to the screw, pass it through the tendon, and then use those strings to tie the tendon back down to the bone. It's done as an outpatient surgery. It's usually done under general anesthesia. Oftentimes we'll include what's called a nerve block, so that when you wake up from that surgery, your arm is numb and you feel no pain. It can be done usually typically under 2 hours, and really your recovery depends on the size of the tear. If it's a small tear, your recovery can be fairly quick. I say fairly quick, usually less than 12 weeks. If it's a larger tear, it can be upwards of 6 months of recovery.